HIV by race in U.S. This statistics will shock you. 1. White Americans made up about 24% of new HIV diagnoses in the United States. Approximately 9,112 cases total, even though they represent around 61% of the U.S. population. White men account for 7,433 HIV cases, while women are roughly in 1,079 cases. 2. Black African American communities disproportionately affected. Though they make up 13% of the U.S. population, Black Americans account for nearly 40% of new HIV diagnoses. Contributing factors. High prevalence within the community increases risk of exposure. Social determinants, poverty, housing insecurity, limited access to health care. Stigma and mistrust in the healthcare system. See, Latino Hispanic communities account for around 25% of new diagnoses while comprising 18% of the population. Barriers include language, immigration status fears, cultural stigma around sexuality and HIV, or men who have sex with men, MSM, the group most affected by HIV in the U.S. Black and Latino MSM are especially at high risk. Challenges, discrimination, internalized stigma, and lack of culturally competent care. 4. Women, especially Black women. Many HIV prevention campaigns overlook heterosexual women. Black women account for the majority of new infections among women in the U.S. Contributing factors: intimate partner violence, power imbalances in relationships. 5. People who inject drugs, PWID, HIV transmission through shared needles and syringes, rise in infections in rural and suburban communities due to the opioid crisis. Harm reduction strategies: syringe exchange programs, safe injection education, MAT, medication-assisted treatment. Challenge: stigma and criminalization prevent many from accessing care. 6. Incarcerated individuals. Higher HIV prevalence compared to the general population. Risk factors include lack of access to prevention tools like condoms or PrEP, needle sharing, and unsafe sexual practices. Post-release. Many lose access to HIV treatment and fall through the care gap. 7. Transgender individuals. Particularly transgender women of color face some of the highest HIV rates in the U.S. Barriers: extreme stigma and violence, lack of trans-affirming healthcare, discrimination in employment and housing. 8. Youth and adolescents, 13-24 years old. Many are unaware of their status. Barriers: lack of comprehensive sex education, confidentiality concerns, peer pressure, and online exposure. To fight HIV effectively, we must address the unique realities of every community, not just the condition. 8. Youth and adolescents, 13-24 years old. Many are unaware of their status. Barriers: